Hello and welcome. Today we have a very interesting and a special guest. And let me introduce Dr. James Odell. Has practiced traditional naturopathy for over 35 years. He graduated with a doctorate in naturopathy from U.S. International University, later renamed Alliant International University. He has begun studies in traditional Chinese medicine, and having gained conversational fluency in Mandarin, he moved to China in 1986 and completed postdoctoral studies in traditional Chinese medicine at Shantou University Medical College, with medical residences at Shantou University Teaching Hospital, Shantou Central Hospital, and Shiwan Hospital, Guangdong Province. Since returning from China, he has completed several internships in European biological regulatory medicine at the Paracelsus Clinic in Switzerland. And over 10 years, Dr. Odell was the education coordinator for the Biological Medicine Network, which conducted conferences on the principles and practices of European bioregulatory medicine. Dr. Odell is certified in acupuncture with National Certification Commission for Acupuncture and Oriental Medicine. He is also licensed in acupuncture in Kentucky, Colorado, Utah, and South Carolina. He is certified as a traditional naturopath with the American Naturopathic Certification Board and is registered naturopathic diplomate with Health Professional Licensing Administration for the registration of naturopathic diplomates. And over the past 20 years, he has been a certified instructor for the American Organization of Bodywork Therapies in Asia. He frequently presents at conferences on breast cancer, causation, and treatment. At present, he is primarily engaged in writing and research, serving as the executive and medical director of Bioregulatory Medicine Institute, or BRMI.online. Welcome, Dr. Odell.
Thank you. Thank you for having me here. It's a pleasure.
That was a very long introduction, but why I am curious to talk to you, and I'm delighted after our mutual friend, Dr. Simon Yu, have introduced me to your recently published book on breast cancer. And the book is, you called the book Breast Cancer, The Other Story, right?
Yeah, the rest of the story.
The rest of the story.
The rest of the story. I don't know if you remember Paul Harvey. Paul Harvey was a news commentator on the radio. He had a radio show. This was many, many years ago. And his program was called The Rest. He would always tell something, and then he would wait, and then he would tell the rest of the story. And usually it was a humorous story, or it was an informative story in some way. And so that always struck me as this would be a good title for the book, The Rest of the Story.
So let me ask you, what led you to breast cancer and the rest of the story?
Well, as in a practice here, I see a wide variety of people, but many people started coming in with breast cancer. As you know, it's 1 in 8, which is an astounding number. And it not only affects the patient, but it also affects the patient's family and friends. So it really is more than 1 in 8 in a way, in who it impacts. And so I was seeing a lot of it. And at first I thought I need to provide them with some kind of information, some kind of written information that they could sort of, as a guideline, and follow. So I wrote maybe about a 10-page little paper of guidelines, and then I realized that was inadequate. So then I continued to write more, and it ended up being maybe 25 pages, and I still felt that was inadequate. And I thought, I'm just going to write a book. And so I started writing the book, and that was 13 years ago, and I just couldn't put the pen down. You know, it became very compelling to me, and I became very passionate about it, learning more and more about it. And that's kind of really how it happened. So now finally I finished the book. I have it out there on Amazon, And as well as I have a website for it. It's called breastcancertherestofthestory.com. And within that website, there's information. It has the preface and all of the table of contents that you could freely download and look at the book in this way to see what's involved. But it became a very lengthy book, over 700 pages. And even with Kindle, it's over 1,000 pages. So it's really more of an encyclopedic book. It's like 69 chapters long. Each chapter is a different theme. Starts out with just general information, and then it goes into the etiology of the disease, then it goes more into the diagnostics, then the conventional therapeutics, as well as the complementary and alternative therapeutics. And so that's how it's organized.
I have to commend you, because as an author myself on the subject of breast cancer, this is by far the best book that I have read myself. It's informative, it's accurate, it has a particular kind of take on things naturally, because based on your background. It's holistic, and as I said, it's a treasure trove of different information. So let me ask you, let's talk about etiology of cancer.
Yes.
You have a huge section. Naturally, we're not going to go through all 69 chapters, but I would advise anyone who's curious to learn about the subject to get the book. Let's talk about, there's a huge incidence of ductal carcinoma in situ, DCIS.
Yes.
Why do you think there is such a huge number of DCIS patients coming on, especially in the past 10, 15 years?
Well, I do think there's a huge environment, and I see that cancer is a disease of the terrain. And what that means is that a person's environment, their biological environment, as well as their psycho-emotional environment, if it becomes corrupted, then you could develop a tumor. You could remove the tumor, but you must change the terrain. And a lot of that terrain is toxicity, toxicity from the environment. So women, as well as men, often use cosmetics and different things on their skin, which is untested, and a lot of it is carcinogenic. Go online to the Environmental Working Group and find information about which cosmetics are safe and which are not safe. So that's one component. Another component is actually what we eat. And of course, our food chain is very contaminated. It's very depleted as well in nutrients. But moreover, the contamination of pesticides, as well as other types of agents that are toxic that enter into the water and into our food, I think that has an impact on us too. Now, everyone's different in the way that they can detoxify. Some people don't detoxify well because they have certain deficiencies in doing that within their liver, within their organs of detoxification. So these are two areas, what we put on our skin and what we eat and consume into our body. So the toxicity issue and environmental toxins I think are a huge part of it. And that, of course, has exponentially increased over the years. So we live in a very toxic world. The second thing that you see here is also radiation factor. That I remember growing up in Iowa, and as a little boy, they would tell me not to eat the snow. And this was because there was a lot of explosions of nuclear explosions in Utah and Nevada that would create clouds, and the clouds would dissipate over the earth and travel hundreds and hundreds of miles. And we became exposed to that in the 50s and in the 60s. And, this, I think, impacted us. Now we also have radiation from medical devices, from x-rays and CAT scans, and even mammography has been implicated. So this is another level of radiation exposure. I think that is also a factor with other kinds of cancers, particularly thyroid cancers, but it does affect the breast as well. So that's another kind of environmental toxin that we don't often think about that we might have been exposed to when we were young, or that we're still exposed to within medical diagnostics. Another factor that we don't really think about too much is the dental component of it. And so unfortunately, dentistry and medicine have been divorced for some years. And I see people that come in with problems from neurological problems, but they've never really been evaluated by a dentist. So they might have migraine headaches, but then they have, a mouthful of toxic materials, or they might have dead teeth in their mouth, that meaning root canal treated teeth, or perhaps cavitations where the tooth has been pulled and it's become, the jawbone has become corrupted. But this not only affects the neurology of the body, but also can be far reaching into organs and glands and tissues and affect the breast. So this is to say that dental toxicity or a toxic oral microbiome can create a problem within the physiology of the body and be part of the terrain that has been corrupted. Another part of the terrain that is rarely talked about, because usually you're hearing, oh, it's genetics or it's estrogen, and no question, genetics and estrogen are players in it, and I'll get to that. But there's a lot of other hidden causes that we don't often talk about. One of them is the psycho-emotional component. And as I started reaching into this, I found something that was very compelling, that many people that have been diagnosed with cancer, you could ask them, like, what happened 1 or 2 years ago? Did you have a sudden shock to your system? Was there something terrible that happened that sort of just knocked you off your feet? And often is the case, yes, that there was something, maybe it was a death in the family, maybe it was a lost job, or in some way they just became derailed in their personhood, and even maybe in their spiritual life just became challenged. And what this does is that this can weaken the immunity of the body. Any kind of trauma like this, or even long-term stress, can weaken the immunity and lower our ability to really fight cancers. So we know that we have cancer cells in our body at all time, and our immune system usually fights it off, or macrophages find the cancer cells and destroy it. But if you have a shock to the system and your immunity is lowered, then that can become a factor that also can cause a toxic terrain or influence a person to develop cancers. So these are things that are often talked about: the environmental component, the dental component, and the psycho-emotional component. Now, we often hear about the estrogen component, and there's a lot that's written about that. And so there's a lot of drugs out there. You have tamoxifen, and we also have the aromatase inhibitors. Certainly, there's other ways to manage estrogen in the body, but estrogen can go amok, and it can become a problem, particularly in women that, as they get older, it seems like that their liver doesn't manage it well, and that their estrogen metabolism becomes corrupted. So they develop toxic estrogen metabolites. Estrogen goes high and low. Progesterone, which is a protective substance, goes low. And maybe they're already on some kind of hormone replacement therapy, as we know that the horse equine estrogens created a lot of breast cancer in the past. And there was several studies that finally showed that. And so they started pulling it off the shelf, and people instead went to using bioidentical hormones. Well, still, bioidentical hormones, estrogen is estrogen. And if you're not metabolizing it well, that could become a problem. So unfortunately, a lot of doctors that prescribe bioidentical hormones don't really monitor the estrogen metabolites or the estrogen metabolism, and consequently, a woman can become endangered from taking bioidentical any kind of estrogen in that way. So the estrogen issue is a part of it. There's also other hormonal things that play into it. As I mentioned, progesterone going low. Progesterone, as I say, is a protective hormone, and many women do take progesterone. They might take it as a cream or topically on their body, or they might take it orally. Either way, but this can be often a good thing for them and a protective thing. However, a lot of estrogen is given without progesterone. And so it's not balanced in a good way. So we see this again and again as a factor in it. I think the genetic component is probably less than 5% as far as the etiology or the cause of cancer. Though there's a lot of play on it and there's a lot of money in it. Many people are employed to, look at the genomes of cancer. And so this is, I think, part of what I call the cancer industry, and which is another component of the book that I get into, a little bit about the politics of cancer.
You mentioned estrogen metabolites and testing properly. What would you suggest would be a good test to check for estrogen metabolites?
I think it's really useful to test for all three estrogens. We give them numbers, E1, E2, and E3. We have estrone, which is E1, estradiol, which is E2, and estriol, which is E3. And if you look at all three estrogens, then you could make a configuration where the E3 should be higher than the E1 plus E2. So we have what's called an estrogen quotient. And that is a useful test to go by. Another one is the metabolites of estrogen. We have two. We have 2-hydroxyestrone and 16-alpha hydroxyestrone. And there's a ratio between those. And 16-alpha hydroxyestrone is the toxic one, whereas 2 can be more protective. So this is another way to look at it, is looking at the downstream estrogen metabolites and making sure that the 16-alpha hydroxyestrone isn't too high.
Right. Yes.
And I think that's usually where most people go with it.
You mentioned the environmental component. I don't think that women today need to take extra estrogen, although some obviously do, because we are literally swimming in a sea of estrogens, whether they're coming from cosmetics, as you mentioned, or cleaning products, or our food, you name it, plastics, you name it, we've got it with estrogen.
Yes.
Now, other than the environmental component, I understand there's also an electromagnetic radiation, low frequency EMR radiation. Can you address this subject as well?
Well, absolutely. We're talking about what's thought of as non-ionizing radiation, whereas I mentioned the ionizing radiation, like from radioactive fallout and from nuclear medicine. But the non-ionizing radiation is ever pervasive. We're all around it. We're exposing ourselves to it right now is in what we're doing. So this comes from what we think of as electrosmog. It comes out of the walls of our homes. It comes from the Wi-Fi's that we're exposed to. It comes from the cell towers that we're exposed to. And there really hasn't been a lot of studies on this, quite honestly. I mean, and the studies that have been produced often from Europe have shown that it's detrimental and that it can cause a wide variety of breakage in DNA. And so we know that there is a biological detriment from non-ionizing radiation. However, again, this is an industry, a very strong industry, and as you know, 5G is rolling out now. And that will be, there's a lot of controversy about this because it's really upping the volume of our exposure to this non-ionizing radiation and electrosmog. And it's a concern. It's definitely a concern. Some people are more sensitive to it than others. As I say, this is all very individual, just like some people are more sensitive to estrogen than others or other environmental toxins. So this is becoming a true problem and a concern, and I just hope that our governments and legislators become more and more aware of this and can in some way help to protect us from this.
I see you're an optimist. I'm not. But
well, yes.
Let me ask you another question. There's so much talk about sleep, the quality of sleep. What about the melatonin connection and breast cancer?
Definitely, within the last 100 years, as you know, we're no longer living by candlelight or lanterns anymore. And usually it used to be when the sun went down, people would go to sleep. And when the sun came up, people would wake up and they would, live by the sun. And that's no longer. We live very abnormal hours and long into the night, watching TV, and our eyes aren't getting the normal amount of light pulsation or the circadian rhythms of the light. So we're not producing the melatonin, which is produced as we things get dark. Very important pineal hormone, along with other pineal hormones actually. And it's been shown to actually be protective for the body. So it protects the body from various kinds of cancer. And that's why it's often been used as a supplement to treat cancer too. But it's not just that our melatonin is going low. We also have people that work at night. They're working different shifts and odd shifts. And it's been shown that this is also a detriment to the body, that it's not a normal thing, that we're beings of light. Normally we're not nocturnal animals. And I think that can be a detriment as well. But we have to do what we have to do in order to make a living, certainly. But sometimes it's good to, when you go to sleep, make sure you go to sleep in a very dark room. And we think about what's called sleep hygiene. Sleep hygiene with darkness. And sometimes, though, we have to even use maybe a mask over our eyes to black out all of the light. I think this is a very useful thing to do, and it helps us sleep more soundly. But certainly melatonin is implicated, the deficiency of melatonin is implicated as a cancer-causing problem.
Mm-hmm. Yeah, I just realized that we probably have to classify Netflix as one of the carcinogens. So.
Yeah. Well, I think television, having a television in your room, there's two things happening there. There's the electrosmog of the television, and as well as the light that you're receiving in your eyes doesn't allow you to really produce the melatonin.
There's also a difference between blue light and kind of orange light.
There is, that's why we have computers now that you could change the lighting of the computer, and it seems to be easier on us. Maybe we could see the computer screen better, but it's also less toxic. The blue light, taking away the blue light is less toxic. So you're trying to have not exposure to blue light at night, and that seems to be a useful thing.
Yeah, you want to have blue light in the morning to kind of make sure that you're ready for melatonin production.
Exactly, to wake up in the morning. And so we have this circadian cycle of hormones We have DHEA and testosterone and cortisol are all high in the morning, and then they taper off as the evening comes on and as it becomes darker, and then melatonin comes on. So that's a normal hormonal cycle, but a lot of that is being very dysregulated with what's going on in our lives.
You mentioned previously, and you have a whole section in your book on dental or periodontal pathology, and definitely breast cancer. But it's not just breast cancer. Of course, it's a medical issue that affects the entire body. I mean, there's definitely a well-documented connection between periodontal disease and cardiovascular issues.
Yes.
And the more I look into it, and I'm sure you have as well, there's definitely a connection between periodontal or dental issues and breast cancer, such as root canals treatments or overall periodontal disease. What about things like extraction of wisdom teeth, which almost 70 or 80% of all teenagers living in North America have experienced? As soon as they hit 18, 20, 19, the wisdom teeth are being extracted. Supposedly, it's a good thing, but as we know later on, 10, 20 years later, we realize that, oops, maybe we shouldn't have done that. What's your thought on that?
Well, any kind of extraction, you have the potential of cavitation. And what that means is when you extract it, that leaves a hole. The hole may become actually diseased. It doesn't seal up very well. And so that's a hole in the jawbone. And then the jawbone starts to become necrotic or diseased. Organisms start to breed inside that hole or that cavitation. And these organisms, many of them are very toxic. There's not only just bacteria, but there's also other kinds that breed in there. These become actually into the systemic circulation. In other words, they gravitate into the blood, into the lymph, and they're carried throughout the body. And depending on the degree of the cavitation, this can no doubt affect the organs and tissues of the body in a detrimental way. So cavitations, I think, are the main implication of or problem from extractions. I remember I had my wisdom teeth extracted just like you described. I think I was about 19 years old, and they yanked them out of my head, and actually the left upper quadrant, that particular tooth became a problem, and it gave me headaches for a number of years. At that time, I didn't even know what a cavitation was. Nowadays, we could diagnose cavitations with what is called a CBCT, or let's say a CT scan, a computer tomography scan. It's cone beamed. So this way, it's directed right into the jaw, and they could really look and see if there is some kind of problem there. As well as root canal treated teeth can be looked at in this way. So that's much better than a Panorex or any kind of digital imagery. In fact, this is really the gold standard now, a CBCT scan of the jaw. And so mostly, though, this is a tool of people who do, like endodontists, people who do root canal treatment, or people that do extractions like oral surgeons. But so a lot of dentists don't have them in their office yet. So you have to endorse to find a CBCT scan to see if they'll do it for you. But I think this is a very good diagnostic to determine if those wisdom teeth have been corrupted, if they did cavitate. That's a useful way to go, actually.
For sure. The only problem is extra radiation going into your jaw.
Well, this is true too. Then you have extra radiation. I mean, There are other ways, that can be that can be diagnosed, but generally, that for some people, they need to have the this verified before they get in there and start digging around and doing cavitational surgery or something like that.
Yeah, it's important. I had that done myself, and just like you, I think I was also 19 or 20 years old, where I had an impacted wisdom tooth.
Uh-huh.
In other words, I don't know why they called them wisdom teeth, but maybe I was half wise or
Yes, yes.
neither here nor
Well,
there, so they decided to put me out of misery.
well, that impacted wisdom teeth are interesting. Some people have maybe seen those dental charts where different teeth correspond with different organ systems of the body. This is a very ancient traditional Chinese etiology, or we think of it as the electromagnetic or in the small intestine in Chinese medicine. So on in life can cause problems with the heart.
Mm-hmm. Yeah, yeah.
So that we often think about what tooth is diseased and what organ on to.
Yeah, that's a very interesting system, and many dentists, at least the ones who are kind of holistic by nature, would have that chart. But as you said, the medicine and dentistry have been divorced. I call it that dentistry has been decapitated from the dental field. Um,
Mm-hmm.
so and unfortunately, those two groups seldom communicate. Um, to the detriment of their patients. I mean, we know, and I'm sure if you ask most of your patients, when was the last time your family doctor asked you about your dental health, the answer is quite obvious, right? And vice versa, dentists are not really allowed to subject patients to even heretical theories like acupuncture meridians from dental pathology going into someone's organs.
Yes,
They'll
yes.
find out quickly what's going to happen to them, even if they start this discussion in their dental office. But that aside, we can talk about etiology. If you're able to, I'd like to kind of do another segment with you because we have identified many ways or kind of variables that lead to breast pathology when it comes to breast cancer. But I don't want to kind of leave on kind of on this note because yes, we know what's causing cancer. We also know or don't know many things that contribute to causation of breast cancer. And I'm really happy that you brought up the psycho-emotional component because everybody is talking about everybody else, but for some reason avoids this big dark hole called the
The
psycho-emotional.
elephant in the room, yes.
Yeah, but can we have maybe another session where I'd like to talk to you about specifically prevention? What can we do in terms of nutrition? What can we do in terms of supplementation? How do we avoid toxic exposure? And so many other things that women can kind of learn and educate themselves to try and prevent breast cancer. Because as you said, 1 in 8, and yes, it is an interesting statistic that's, it's close, now it's getting closer to 1 in 7, obviously in their lifetime. But, when it comes to cancer, whether it's men or women, with women, it's 1 in 3. With men, we have to outdo women and have better numbers, as 1 in 2 will eventually be dealing with some form of cancer in our lifetime for men.
Yes.
And what goes for women and breast cancer, many useful things can be applied to men and prostate cancer as well. So
Yes.
I want to thank you for this illuminating kind of conversation. I'd like you to to promise that you'll come back and we have a chance to give people some form of solutions, not just scare them into, they're surrounded by all these enemies that are trying to get them. Well, are you okay with that?
Yes, of course, I would love to. Thank you.
That's great. Thank you very much. I'll just stop this and.
Thank you so much.
Yeah.